Welcome, everyone. My name is Joya Jefferson Nuri, and this is Profound Conversations. This is episode 2 of this season, our third season doing this. And today we're going to continue a conversation we had a couple of weeks ago on trust. We all know the importance of trust in our personal lives, but what does trust mean in the medical profession, for the OPO community, for doctors? What does trust actually mean? So I'm going to read the definition of trust as defined in Craft by Webster's dictionary. Webster says, belief that someone or something is reliable, good, and honest. Relationships is founded in mutual love and trust. It goes on to say that assured reliance on character, ability, strength, or truth of someone or something, one in which you place your confidence. That's how Webster defined it. And we have 3 really great guests today who all come from backgrounds that are founded on trust. Our first guest is Michael Browning. He's a nationally recognized health program developer. Welcome, Michael, to the program.
Thank you. Good to be here. Quite excited about the topic.
Thank you. Thank you. I'm glad you're here. Sean Paul Harrison is the physician and donation specialist for the Louisiana Organ Procurement Agency. Sean Paul, welcome.
Thank you so much. It's an honor to be with you all.
And those of you who know anything about Profound Conversations, you know Samuel Sharif. He is a co-founder of the Daniel Sana Sharif Foundation and the Muslim Life Planning Network Institute. He's also the co-executive producer of Profound Conversations. Welcome to this side of the camera, Samuel.
Thank you very much, Joya, and everyone involved.
Thank you. I read the definition of trust. How did that resonate with you, Michael? What did that mean to you?
Well, you mentioned my background in public health, and in public health, it's essential to have trust between those who provide services and those who are consumers of services, and everybody who supports those consumers of services, their village per se. And that village is a group of folks who work together to make sure that there is sound trust in the community in relationship to whatever the public health topic is. We've seen recently here with COVID how important trust is. And for me, that was essential in pulling together a group of folks to help folks through every phase of this pandemic. And it was quite essential for those folks who are people of color, especially those members of our community who are Black, African American, and the levels of trust throughout the community, which was essential to really get folks involved in coming up with strategies to really address our complex issues.
Okay. Sean Paul, trust, defined by Webster. How did that resonate with you?
One of the first things that came to mind is just vulnerability, in the line of in working with organ procurement organizations and hospitals and physicians. Ultimately our focus is on these families that have lost a loved one, something that was greatly unexpected. And, in order to share that space with them at that time, to support them, it's the most difficult day of their life. And to earn the trust of a family that's lost something, and you're trying to gain something from them, it's finding a balance to be able to be in a safe place to give them, all of what you have, and for them to allow you to enter that space. And ultimately, hopefully, give some hope to them, and also to save the lives of others through their hero.
So this would be something by which you want people to place their confidence in you, your organization, or people who do what you do.
Yes, ma'am.
Exactly. Samuel, you heard the Webster's Dictionary version of definition of trust. How did that resonate with you?
Joya, for me, I keep it on the personal dynamics, and everything for me goes from there. December 5th, around 7 o'clock, 1968, I met the woman that's still my wife. It took trust from the time that I met her in the union at university and all of these years up until now with her and my family to get to where I am now. And for me, trust and the integrity that for me is the foundation of trust means everything. So for it to go any further than that, I don't have a lot. The trust is for me, for us, I was sharing with you the personal story, and I'll leave it for me personally. A number of organizations, I'm 71 years old, that I've been with. And trust, as I look back over my personal relationship, the lack of it not being there or the trust that was there for what, basically for all the organizations, all the relationships that ever failed. And many of them in 40, 71 years after me were because of the trust being broken somewhere. Regardless, I was there, regardless of who it was the trust that we have. The breakdown is a word that we use. For me, it's become a jargon in the community, in the organizational development space. It should be jargon rather than, it gets from cliche to a jargon. But trust is much more than that. And it should be the foundation for everything that we do. And that's the way I kind of look at it. It's a term, but it's much more than that.
That brings me to my next question for all three of you gentlemen. Samuel mentioned trust being there, his wife building that trust. That ties into your personal integrity, your own value system. You each have professions by which you are building coalitions, you are building relationships. On a personal level, what does it mean to your own personal values? Not just a job. It can't be just a job. And I'm going to go to you first, Michael. Your personal values and the work you do.
Well, thank you for that question. And I appreciate that question quite a bit. It's almost everything that I do is trust is woven into every aspect of it, from researching a project to writing up a project to implementing a project to evaluating a project. Trust is essential. And growing up in an African-American community in near Detroit, trust of the system was quite important because of the fact that 99% of the institutions were not institutions with Black leadership or faces of Black people when you walk into the door. Maybe a Black doc here, a Black nurse there, but 99% of the services were not. And so there had to be this propensity from within us to want to trust them, which was developed through our parents. And our parents taught which folks you trust and which folks you do not trust. And I think that's inherent in any African-American family on how we look at services. But their propensity to trust is something that's developed through time, through family, and through institutions. So what I do is trust is the very first conversation that I'll have with any collaboration that I engage in, especially around health and public health. Because of the historical nature of some of the things that have happened in the Black community, we have to start off acknowledging those things so that we can begin to build that trust, that mutual trust, so that we can move forward with whatever that services is. So for me, it's almost an essential guiding principle for every aspect of the work that I do.
And it sounds to me, Michael, that what your parents taught you to do was to develop an instinct. You can tell who people are pretty much in the first 10 seconds. You may not know their story, but you have an instinct that tells you whether you're comfortable there or you're not. I mean, I've met people of all races on the planet, and I trusted them immensely from the first conversation.
Absolutely.
And there are people who are walking toward me that I've never talked to. I'm like, I don't know about your energy.
Right.
So it's an instinct about trust. Jean Paul, I want to go to you about personal values and how it ties into what you do.
Michael brought up a good example. I mean, it's something that I was thinking of even going into the day because, there are so many people that influence you from being a child to a young adult and to an adult. And, my father was the greatest example for me because, relationships and that foundational relationship building that you have and trust. Again, whenever we have new staff members that come into our organization, I've been here, I made 19 years almost 2 weeks ago. And one of the things, whenever they ask me what is the key to being a success in this organization, it's not about being successful in an organization. It's about being successful with people, and trust in those relationships are the most important things for me personally, and also as an agency. But and then I use that as far as for how important it is, in working with physicians, and I'll probably get into that a little bit more. But I want to go back to the families because, like you just said, you can almost tell something about a person within those very few seconds. And whenever we go to support a family during that intimate time of loss, we are a stranger. They don't have any idea who we are, and we're going into to support them. And so you do have to have, more than just, one thing I'll say is there's no agendas. It's basically helping people, genuinely and sincerely helping people, no matter, the different race, socioeconomics, all of these different things. We even we have a lot of language barriers and stuff like that from time to time. And it's making sure that you can give everything that you have of yourself to help them and not gaining something in return.
Earlier, before we came on the air, Michael, you talked about terminology, and Sean talked about language barrier. Sean, from what I was hearing, may not necessarily be language barrier as in English and Spanish or Chinese and Vietnamese, but it could be language barriers that are cultural. And so, Michael, tell us a little bit about terminology and maybe those cultural barriers that you both have to face in the work you do, and it's language.
There's always a word about words. For example, the word procurement. That's a word that's difficult for Black people to hear when you talk about a very important decision, like John Paul said, that you'll need to make, within a relatively short period of time. And so, first of all, they're going to have to think about procurement, and then they'll think about, well, that's related to buying some type of service, some type of something, but it's related to business, it's related to commerce. And one thing Black folks don't want to hear is that, the donation their family members sell organs is about somebody buying or trading and doing something is for commerce. And so, that's a particular word that needs to be broken down so Black folks really understand the concept, and probably not used when you're addressing Black people around this particular issue. And so we learned a lot about that. Again, I'm going to use COVID examples because of the fact that it's hot and burning, and there's so many lessons we learned from this about the terminology that we use about even vaccinations and the testing because of what happened in Tuskegee and other leaks and other experiments on our people. We have to break down those words and concepts and perhaps shape them in a way that's culturally appropriate and sound for our community, and that they don't have to go back and look up in a dictionary and try to determine for themselves what it really means. And that's that trust propensity, is that, we trust you because you're reliable and that you're providing consistent, credible information in the language that we can receive it. And I'm glad Jean Paul talked about the language barriers, because for us, it's not a different language per se, like you said, Spanish, Chinese, Vietnamese, but it's the context in which you speak to us, and it's the way in which you speak to us, and the way that you break it down to let us know that you really understand what we as Black folks are experiencing, especially when it comes to loss, because the loss in a Black family is so very different from losses in other families. I've had the experience in public health to work with all nationalities. And when I'm with a family who's going through loss, there's a way that Black folks mourn, and a way that Black folks think about organ donation that I think is very distinct. And so finding those key words that will engender trust is essential.
And Sean Paul, I want to ask you about a word. I want you to respond to what he's saying, but I want to add a word in there. He used the word procurement.
Yes, ma'am.
I want to add procurement to harvesting. Right. And if you could please address what what Michael said.
Yeah, no, and I appreciate. I was going to piggyback off of what Michael was saying as far as for the language, and another way I even view it is just the medical terminology, and the way that we break it down for everyone. And one of the things in working with hospital staff and physicians and also our group in doing training is making sure that we're not assuming that something is understood. Harvesting is not is a word that we have not used for over 20 years.
Okay.
Because it is something that it's the recovery of organs or the recovery of gifts that will save someone else's life, and that's not trying to make it in a way that is the right way to say things. And also, like with procurement, it's the same thing as as far as for the recovery of those organs to be donated and transplanted to someone else in need. And so when we're talking about not talking to especially not talking at a family, and one of the things too is asking questions. It goes back to that assuming, where in a lot of the relationship building with physicians, because they don't get this training in college. This is not a part of their curriculum. This is a part of life experiences and working with families and making sure that that we recognize that families sometimes they don't even know what questions to ask, but giving them the opportunity and not assuming that they understand it, and also not having a judgment if they don't. A lot of times just the intimidation of being in a foreign place, much less a hospital, and then you're dealing with all of the heavy load of losing a loved one and having to make decisions. Because as far as for organ donation, this is not generally someone that's been in the hospital for weeks or months. This is something that where they've suffered this within a day or even a couple of days. So this is a lot that they're trying to handle to make sure that we can walk them through this grief journey and offering them the opportunity of donation at the appropriate time, not as soon as you're introducing yourself to them.
Samuel, you have built organizations throughout your career. And as the founder of Muslim Life Planning Institute, can you address this issue of trust and languaging for us?
Important. Thank you, Joya. 45 years ago, we were introduced to a term, words make people. Slogan, words make people. Over the years, that's taken on it's been magnified exponentially. Words make people. And then I was fortunate enough through Kareem Ali to be introduced 5 years ago to a group of storytellers, scholars, where social architecture, the language of social architecture came into play, where the words took on a different meaning, even more so. So trust became a great part of our work, so much so inside of what we're doing now with the organ procurement. It was trust that emanated first off from 45 years ago, that it becomes more these words that make people. What happens with that? What these words mean? So when we say trust and we put in that perspective inside of our work to make people, it helps us with our decisions. And like you made a mention of something that I heard, I'm speaking inside of organization with that. You're the first person I've heard say what you said. I've shared that with Kareem years ago, maybe 20 years ago. You put in situations, whether we realize it or not, especially if you're ever in the environments outside of yourself. If you're young and you come out of an inner city, and if you enter into another person's space, and you do that a lot, if you experience that, what you experience, you have to learn. And I shared that with Kareem. I had to learn at an early age, St. Louis, Kansas City. I came to Kansas City when I was at 5 years old, but St. Louis before then, parents out of Chicago. That sense that you spoke of, as you grow older, you learn to detect and sense. And most people, I've never heard anybody speak of that like you did. I said, Kareem, I had to learn before I was an adult. To see people coming, I was a little guy, and be able to detect, pick up some things, understand what might happen and what I might have to do for myself. So now, and that word trust now, as we deal with organ procurement, that was one of the first experiences that where I had inside of this work was there was an instant trust, the same thing that you said when our daughter passed, and she was lifted to a center in Tampa. That was 2006. And my wife and I were in Washington, D.C. My daughter was in She might have gone out of the country. She was in Cleveland and my son was in Atlanta. The next day, which was a Friday, 29th of really the 30th of May, 2006, we came into the hospital. There was something about, I thought the person that was a hospital staff member was a quasi, there was an organ procurement professional. My son came in a few minutes after, my daughter came in, my wife and I were there, and the conversation began about our daughter in a way that, wow, my thing was this doctor in this hospital, they're talking about, she's in a coma. They're asking questions and about the type of person she was and strength that she might undergo this. So the trust was starting to build. And I shared this with this part of the story, and I shared it with Kareem, I shared with a lot of people, that by the time when I found out that there was an organ procurement, that position not necessarily was the staff of the hospital, it was an organ procurement professional, a physician, as it is. And then we met people from the hospital, that this particular hospital, the Tampa Center, same type of feeling from when the doctors and the nurses. So they didn't ask us about Danielle's organs until after lunch, the afternoon, when the organ procurement person came back. And when she asked, we knew nothing about organ procurement. That was not something, I don't know if it was our way of life. That wasn't something that was familiar. I asked Danielle's younger sister, she said, Dad, that's something, Dan, what they're saying and the way these people, that's something that we would do. Danielle would want that. Our decision was easy. I found since Kareem and Linda and the other professionals that we've worked with have been out this 5 going on 6 years, that's not the experience for other people, especially from people of color and a lot of the religious communities. They have these, I call false narratives, stories, they come from somewhere, stories that have been told maybe by relatives that really don't depict the industry. That's why we've been
Your
here.
Experience with it at all.
Yeah, they don't really depict the end professionals.
Sean Paul, would you like to respond to that?
I would, thank you. One is, Mr. Samuel, thank you for sharing that story about your daughter. That really adds so much to today. And what I would like to say is that, that is very important. Trust is the utmost important thing in what we do, is because one of the things that we've really worked hard at and put all of our efforts in is to make sure that the conversation of donation does not happen prior to a family being notified of their loved one's death, because that's where trust is completely lost. Because if you go into a hospital and your expectation is for your loved one's life to be saved, and you don't know that they have died, and maybe and oftentimes there has been times where the conversation has happened prematurely of a person dying, asking about donation, and that is, I could get on a soapbox for the rest of this day, and I apologize, but no, it's very important, because they go into the hospital and they're expecting their loved one to be saved, and then the next thing you know, there has been times where conversations of donation have come up. And that's when there's challenges, roadblocks, all kind of things that become a part of this process. And they can't even start the grieving process, because now they don't believe everything that was done to save that person's life. They think, well, all you're doing is we brought your loved one here, and now you just want their organs to save someone else's life.
Right.
And that is not the process. And I apologize for any family that has ever gone through that. So we make sure that once a person has died, that's the only time of when the conversation of donation comes up, unless a family is asking questions prior to.
Exactly. I want to now go into what I'm going to call the nitty gritty. These relationships, as Samuel gave a great example of how the procurement doctor came in and established himself. And so there was this coalition building, and then the regular doctors, and then later on, and there's all these steps that hospital in Tampa obviously thought all the way through. And as you're saying, Sean Paul, not everybody has thought this all the way through. Their policies may be off. You guys know, but I want to say for the audience, Profound Conversations is built not just with a group of people sitting in a room, making up the topic and making up the questions, and then, bringing in a moderator. they have ideation labs where they bring in the best in the field to talk about it, the head of this show. And then the show is shaped around that wisdom. Well, in the last ideation lab, there was Karima Abdullah, who is the retired director of the National Community of Anti-Drug Coalition Institute. And she started a conversation in the ideation lab that I thought was so profound. I've asked the producers to play a part of this for us. But she has a profound quote that I want to read to you before we play the video. And she says, the increase in trust is proportional to the increase in great outcomes. So we could listen to Ms. Abdullah for just a few minutes here. And then I want to come out and talk to everybody here about that. And also, if you're listening to us and you want to add a question to the chat, please do so. We'll read those in our Q&A section. But if we could listen to Karima Abdul right now, that would be wonderful.
Trust is the bedrock and foundation in any relationship. So where there is no trust, ultimately there will be chaos. And what we found and what I know from experience is that any type of work where multiple people, multiple entities who may have a shared agenda, but then have their own specific goals and objectives for their organization, community work is messy. And because it is messy, the first principle is trust. And when we found that trust wasn't present, it was generally due because one, each organization had not clearly identified and established what their role, what their desire, what their goals, and what their, some people believe, hidden agenda might be. And if people perceive that there's a hidden agenda, then they're less likely to trust and to be able to give all that they can to the success of the collective endeavor. So we always made sure that we looked at the principles from the levels of co-work. And these levels of co-work allowed us early on to establish the trust factor by making sure that there was complete transparency, everyone's organizational role or individual desires and their agreements for impact were clearly delineated. When there was lack of communication and there was not transparency, trust became even more difficult. And it certainly did cause, in a lot of communities, the results not to be as great as or significant as they could be. So we had every member of the team for every initiative that we worked on establish where they were in the levels of co-work, starting with no communication. There are people who, you know, you can try to force people to engage. And if they are at a place in their work and for their organization where there's no communication, we honored that. That meant that, you know, you could send them information, but it would be one way. I mean, we could keep them informed. The next was communication, where they were willing to accept communication. They might send us communication, but you aren't expecting that they're actually going to work at that next level of co-work, which is going to be cooperation, right? Where they're willing to work and put a stake in the ground, and they've got an investment in the outcomes that you're all working toward. So we had those folks that were, you know, willing to cooperate. So that means they may provide information, they may provide some people but clearly identifying the roles. The next was coordination, where we've decided that for this particular initiative, I'm at the level of coordination where I'm willing to work on a committee, work with a team that has specific objectives and outcomes and timelines. And my organization is going to send a decision maker to be involved and engaged in that process, so that we are not operating in hearsay. We've got a stake in the investment. We are present, accounted for, and we're holding ourselves and this entire entity accountable. Then we had the next level, highest level, being collaboration. And collaboration meant that we're willing and we're invested in working together to create something new. And as we're doing that, we're willing to invest more, whether it's our, not just, it could be human capital, it could be financial resources, it could be, facility space, but we're willing to put in more, and we are committed to creating a new innovation, perhaps that may not exist, but when we complete this, there are going to be better outcomes. We're going to have targeted evaluative measures that's going to allow us to know that we've been successful in the work that we've done.
When I first heard that, I don't think I have heard building an organization, building a coalition broken down like that, but I bet you in all the coalitions I've been a part of, I can identify the people in each one of those steps. Okay, so I would love for anybody to jump in now to talk about what he calls co-work. You all have to have, I'm going to start with Sean Paul. I'm going to start with Sean Paul simply because in the work you do, you have to build a coalition with a lot of people, families, whatever process you're using for donation, securing those donations, all of that has to be. So what did you think about what Karima Abdullah had to say there?
Well, one is I was a part of that ideation lab and heard that at the time, and it stuck with me ever since. And going back to, I'm not going to go through the entire story, but I wanted to go back to as far as for, those times when maybe there was a process breakdown, those conversations that maybe had happened prematurely, and unfortunately we see those less and less because of what she said with the collaboration, because this is not something that just a LOPA or the organ procurement organization can do. We can help direct it, but ultimately it's because of these families and also the lives that need to be saved that are on the waiting list. Those are what we're working towards. But you're right, in building that coalition within the hospital, there's so many people that are a part of that process of supporting families, not just the physicians, the nursing staff, palliative care, pastoral care, all the ancillary departments. They're all touched by this. And there's a piece of trauma that everyone feels through this loss, because this is not the transplant side. This is the death side of it. And so, I think that what you see more and more within these facilities and these hospitals is the impact that it has, not just on the lives being saved, but what it gives to the family. That despite their loss, something good can happen. Maybe not today, but they see these families coming back. And during the course of that process, we're doing things like honor walks for their loved one, flag raising ceremonies, heartbeat recordings, things that we can do for the families so that everyone feels and knows that this person that has died is a hero, saving the lives of others. And I think that does build that trust culture within the hospital, that you're all working towards something that can help others.
Okay. Samuel, your comments on what Karima had to say.
That's so important to our organization. Very short, I'll make it very brief. Joya, we organized maybe 4 years ago as professionals. It was Kareem, myself, and Linda came. I was staying in Atlanta. Linda was living in Maryland. Kareem was in Maryland, and Linda was in Pennsylvania. We came to Washington for a weekend, 3-day weekend, and we organized around. We had a chief executive, which Kareem is still a chief executive. What Kareem does for us, we created. He's the executive leadership, but his is the chief relationship officer. That's how important the collaboration is. If you go to the conversationalist page, you'll see some of the most renowned individuals early on in the first season, Dr. Josh Sharfstein. You'll see Sandro Galea, Boston, and others all over the country. He used that office to do that, to get us to where we are now. To us, that the foundation of it is relationship building. And for us, it's interchangeable. That one is interchangeable with coalitions. And I don't see us being successful anywhere without that. Kareem announced this at the very first of this, or maybe you mentioned it. Building healthy communities is the foundation, and where we've been here 5 years at, it's building healthy communities. And what we believe in this space with the organ procurement, there's a goal of 50,000, increasing to 50,000 for 115,000 people, but at 50,000 a year on the list.
50,000 people are on the donor
No,
list?
there are 115 people who need organs. There's 50,000 goal within the next few years that the organ procurement organization is working for. We believe inside the public health space with coalitions and collaborations, and we do what we're supposed to do, what Sean Paul said. There'll be people all over the country. There won't be 115,000 people on the list. There'll be, every time there's organs available, there's someone in the country, because of how America feels about Americans and our community, not just in organ procurement. What happens with those, that's a caveat of something beyond. If we build the healthy communities, like we believe it can be built. So, and that can be done without the collaboration. That's
And I just say this too, is that, Mr. Sam, this is a quick comment. I know that a lot of the perspective that I'm giving is inside these hospitals, but I 100% agree that the culture, the trust, it starts in the community. If the community trust, when they're in that situation and they're making a decision, that'll be one that they make for themselves and other people. So it does start in the community. Thank you.
Michael.
Yes, well, thank you very much for that and showing Karima. She is definitely an expert in the field, and I've worked alongside her on that level of co-work since the late 80s, early 90s, and I know it to be fact. The information that she has shared. And even, at my level of the co-work and coalition work around public health, I was most recently involved when a total breakdown of trust with a COVID coalition that was set up to do exactly what she talked about and what we plan to do here around public health issues and decisions that families need to make. And it was all because of the fact that there was not that clear understanding up front about shared resources and shared knowledge and shared clientele. And so I know where the breakdown was, and helping others to see that is going to be essential as we talk about, the procurement of donors and that whole issue, because as Sean Paul said, and I really appreciate everything that he has shared thus far related to this, to make a decision like that in such a short period of time when you're grieving is just so tough. And that this co-work is so essential, because what it does, first of all, it shows that there is a reliable system with the folks that you work with, because they have a system that you can rely on, that it's consistent. So if you work through those steps that Karima just talked about, there's consistency there. And folks need to know that you're consistent. You don't have a way for Black folks, you don't have a way for this folks, have a way for that folks, but it's a consistent across the board, and that there's some sincerity in the level of work that you're doing, that you're not only here because of your agenda, but you're here because of the collective and shared agenda, and also integrity. And that's one of the main points that we like to push around trust and co-work and collaboration, is that I'm coming here, I know that my agency is funded to do X, Y, and Z. I'm putting it on the table. That's why my director allowed me to be here. But I buy into the shared collective vision of this group of making sure our people have the opportunity to do whatever it is, X, Y, and Z. So those levels of co-work are just essential in pulling our people in.
Yeah. Sean Paul listed off some of the people who are part of the co-work in a hospital to talk about this. Everybody touches everyone, you said. But I know that in the African-American community in general, that there is a fear of organ donations based on historical abnormalities around Black people and their health. I mean, the Tuskegee experiment comes in, and then there is this fear that, as you mentioned earlier, that you're going to take my brother's organ to save somebody else when you could have saved my brother. So if I say yes to this organ donation, you'll stop working on my brother. I'm wondering in this co-working to overcome this cultural distrust, would the co-working process be illuminated if you got pastoral sororities, fraternities, the Greek people, involved in this conversation, because people depend on their pastor. If you went to college as a Black person, you more than likely belong to some Greek organization, okay, to bring the thought leaders in the Black community, not the politicians. I'm not recommending the politicians. I'm not recommending not one politician, but I am recommending other people who help shape Black thought. Should we expand the co-working arena to include those voices as part of the community outreach? I want, anybody can answer that. Whoever wants to answer that.
I want to answer it really quickly and then allow others, because the work that Karima just explained, that part is key, because there needs to be those folks and those faces and those voices at the table. My mother just started discussing the end of life, her end of life with us when we were very young. So by the time she passed away, there was no arguing, there was no this and that. You hear all the time that, folks fell out and, don't speak to each other after somebody died because all these tough decisions need to be. None of that happened. It was only because she instilled in us and had us sit with her to plan this out so that we were clear. So including family members, sororities and fraternities are absolute. Faith leaders are absolutely essential in doing that, and other civic organizations which touch communities. And one key element of that trust is to make sure Black folks know that you're not just going to be harvesting my loved one's organs.
Well, we haven't used harvesting in 20 years.
Right. Absolutely.
Michael, I thought you learned something.
Today. I learned something today.
Yeah, well, when you mentioned it today, I just wanted to throw that back out there.
Yeah,
because I'm using it in a cynical
So
sense.
Sean Paul, what will we say now? What will we say now?
The recovery of those organs to stabilize.
So in a
the
cynical
gifts.
sense, in a cynical sense, I'm using because they think that you're taking them to give to some white folks. You're taking them to give it to the rich folks,
as opposed to it being a gift.
And that Black folks are on that list to get them and not at the bottom of the list, so that we're not even on the list of receiving those donations, because that's that perception, is that the rich are going to get them and the poor folks and people of color are not going to get those organs. So that's something that needs to be dispelled. And I think that that's where that harvesting come in, because they think you're harvesting to give them to those folks over there and not to our people.
Well,
I mean, community education is definitely the key. Community education is definitely the key of where it all starts. Like I said, before you're ever entering the walls of a hospital, hopefully, we never wish for anyone to be in that, but, obviously, as far as for reality, that's not the case. And, fortunately, we have some wonderful volunteers, donor families and recipients that are African-American. They're in the community with us, which is so important. It's one thing for me to go out and share, but when you have someone that has been through that experience, who's walking that grief journey, or has received the gift that is sharing in these same places that you're talking about, that's where it needs to be.
I want to applaud your mother, Michael, for having that conversation early. I started that conversation with my daughter and family. It's in my advance directive that I'm an organ donor. I hopefully by the time I die, none of my organs will be worth it to anybody. I'll be so old. I'll be 100. But I have made it clear. As a matter of fact, I even walked through my house and looked at all the art I've collected around the world, and I've already told them who gets what.
Exactly.
So there'll be no argument at the end of this. So Samuel, what is your response to including Greek societies and all the other whole community into this co-work?
I could not differ from what either we're aligned. Everything that Michael and Sean say we're aligned for. Maybe I say it's from the soul. Right. For us, I'll kind of reiterate, building healthy communities. 7 years ago, Kareem attended a book signing of Building Healthy Communities Through Medical Religious Partnership. It was written by 3 doctors at Johns Hopkins. They were the first of the coalition building for us. And they're still there. Dr. Hale, Dr. G, Dr. Bennett. So it's for us, everything's about that. It's as we build the coalition, building healthy communities. So we build healthy communities, and everything that they're saying are part of course, we want all those people who have those same interests, which is the interests of humanity at stake. What we find fortunate for us at MLPI, we're considered a Muslim organization because that's the name we have. However, our approach is universal, and we started with the book that comes out of Johns Hopkins, which a lot of people have not but should read, and we bookend that with Dr. Galena as well, which is probably one of the best books that's ever been written about what health and healthcare should be about in America. If we build those communities, we want the people who, and there are a lot of people like Michael mentioned, Sean mentions inside, there are a lot of people who want for us to be better human beings. And health, I share with the Oregon Procurement, and some of them hear me, and maybe they don't hear what for us to be here as long as we have, one reason is the industry that's gifted with something next to, that's why some doctors might not be aware of it or closest to creation inspired of God is the organization industry that actually does save life, period. That's the industry. We're inside the public health. So for us to be building communities and starting at a place where the people with the utmost responsibility and devotion to life saving. So definitely, and we want everyone who can be a part of that, and we can help be a part of it. So thank you.
We only have a few minutes left, but I think I'm going to, first I want to acknowledge Michael's Greek organization, which he now displays behind him. And which organization is that? You're Kappa?
Kappa Alpha Psi, dear.
Okay.
Just another pretty boy.
I'm not Greek. I'm not sure if Sean knows, just assuming. So I didn't know what that means. He's just another pretty boy. I guess that's something we knew about Kappa.
Yeah, that's kind of inside. That's kind
of inside baseball. Okay. Okay. All right. So let's open it up to the audience for any Q&A. Well, and going through the chat, I'm really bad at this, people. This chat thing. I don't see any questions. Oh, trust and transparency go hand in hand. Perhaps the language and mystique surrounding the industry may benefit from appropriate and progressive marketing, activities that enable the conversation to be less scary. Very good point. Less informing and far away from the negative publicity around, she says, harvesting, grooming, and the Black market dark side of things. The truth is, yes, these things happen, and there will always be an opportunity for good things to be negatively affected, but that's more rare than the good that actually outweighs the ills. I want to thank, I'm going to mispronounce your name, but it's Nayyir, Nayyir. So I'm going to mispronounce it. Please forgive me.
Nayyir.
What do you guys think of that?
Yes, I appreciate that comment. And one of the things that I want to add to that is when you're thinking about faith, religion, or associated groups of people, one thing, for example, in the Christian faith, the issue is, okay, well, if I'm going to be resurrected, I want to make sure that all my organs are intact when the Lord comes back for me. I'm still who I am. And so it's an issue of having conversations with folks to help them where they are, because if that's where they are, that's where they are. We can't change that. But what we can do is talk them through how there's another way to look at that in their particular faith and with their particular understanding. So it's really, that trust is always taking that person where they are without any assumptions, without trying to push them into a box or a category, but this is you, and we're dealing with you the best way that we know how to deal with you as an individual.
Sean Paul?
I mean, just for the sake of time, I agree with everything he's saying, and that's why, one of the things that we stand on is donation is not a question, it's a conversation. It's not a yes or no, that because you have to meet people where they're at. What are their beliefs? What are their thoughts? What are their misconceptions and things like that? Because, if you could dispel those, then maybe a gift that they're able to receive and give is not stolen from them.
Right, exactly. Samuel.
I don't have anything to add to that. Grateful that we have John Paul and Michael to be able to share you and Kareem for to build upon where we're trying to go, to have this opportunity. I can add to that.
We have a few minutes left, and I'm going to put all three of you on the spot. Okay? If you had the microphone and the camera facing you, and you wanted to talk about trust, OPO, health, building a better health society, and you had 30 seconds or somewhere around there to say what you want to say, what would you say to the audience? And unfortunately, Samuel, I'm gonna put you out first. You have your.
That's a tough one. If I had 30 seconds, what would I say? I think I'd be awestruck. I really don't know what 30 seconds do. What I would say is that something that Michael said, if we had integrity and values and a strong belief in one another, that we could overcome whatever the obstacles it might be, whatever we're dealing with. With integrity and strong values to make the decisions on, we'll get to the place we'd like to get.
Thank you. Michael?
Yes, and I'd like to piggyback exactly on that integrity piece and reliability. That we're reliable for good communication. We're reliable for facts. We're reliable for looking at each individual as each individual. We're reliable for making sure that the medical procedures and the procedures that occur are sound. We're reliable for consistency, the reliability, so that when that next family is faced with that and the folks that we work with can go back and share, those folks over there are reliable and that they have integrity and you can trust what they say and what they do.
Thank you. Last but not least, Sean Paul.
You know, I was just trying to think about it as quickly as possible because of the time. You know, one of the things that I would say is not only, you know, I would like to say a lot, but the other thing is to whatever we say is that we're following up through it. And I guess it's going back to that consistency, because a lot of people say things, you know, and it's making sure that we can follow through with what's being said. And it not being an empty message. And also the dialogue is not just one sided, but we're hearing about what others, what are their thoughts, what are their concerns, what are those things, so we can meet them again, where what Michael said, meeting them where they need to be met. So allowing us to know the direction that we need to go in.
Yes. I want to thank all of you for taking the time out of your very busy and very important schedules to join us here today for Profound Conversations. As I said to you all before the program, each one of these I host, I come out a better person. I know more. The research informs me, and I can hope and pray that the audience feels the same way, and I'm sure they will. Thank you all very much. Thanks to Samuel and Kareem, our executive producers, and Erica, our virtual assistant, for making sure this happens, and all of the people who line up to be of service to a better, healthy community. Namaste.
You've been a great hostess. I really appreciate
Absolutely.
it.
Thank you. Thank you very much.
Thank you. It was an honor.